About that, I didn't have the link in my meeting agenda. So,
No, you're fine. We're, it looks like our attendees are starting to level off, so we can get started here in a minute.
okay.
Mm.
How many attendees do you have?
Got 46 right now.
Nice.
And then, Mayor, I'd like to introduce you to Julia Orlando. She's on the call from Bergen County, New Jersey. She's
Excellent.
our keynote speaker. She'll be talking a lot about us, actually, which is exciting.
It is exciting.
All right, let's go ahead and get started. I think I want to thank everybody for coming today. This is the OPCS Housing First Forum. This is our fourth in the series, and it is ending chronic homelessness. Just a brief story, you know, when I got involved working with homelessness about 4 or 5 years ago, actually, it was when we had the dream pods down at Vente de Augusto Park. And I got, as an architect involved with the AIA, I started trying to get involved and help, and got into a lot of stakeholder meetings and different, you know, there were all these meetings happening trying to solve that problem. And I kept running into this one really tall guy, and he would say things like, you know, we can solve this. There's plenty of resources. And he just kept saying it. And eventually I got to know him, and it was Tom Litwicki with OPCS. So, you know, he taught me a lot. You know, I thought as an architect, we do camps or tiny houses, and very quickly realized that wasn't going to solve the problem. And it was much bigger and much more systemic. And it really had to do with the way all of our systems work together. So that's why we're excited to have this program today, and to have Julia with us. Real quickly, I want to just recognize our sponsors and our partners. This is in partnership with the American Institute of Architects, the Southern Arizona chapter. We also work in partnership with the city of Tucson and with Pima County. Some of our sponsors are Tucson Federal Credit Union, Bank of America, Swaim Associates Architects, and Rio Nuevo. So I'm Michael Becker. I'm the board chair of OPCS. I'm also an architect with Swaim Associates. And I will be moderating our discussion today. So I want to welcome the mayor. Thank you so much for taking some time with us today. And we'd like to just invite you to make some opening remarks.
Thank you so much, Michael Becker. Really appreciate your time, and of course, my appreciation for all public community services that has really led in, as you said, in an unbelievable effort to think outside the box, to talk to nonprofits and government and organizations like the AIA, to think about really eliminating homelessness. And that if we do it in a smart way, in a unified way, that we can accomplish that goal. For far too long, we have been managing poverty and have been managing the symptoms of poverty and homelessness. And it's time for the city of Tucson to think about how we get to the root of our problems, of our issues, to the root of poverty, to the root of homelessness, and think about offering a home to people first, and then wrapping around the services that they need in order to move away from homelessness. So I'm really happy that you're all convening. Really amazing to see all of the smart people that are joining this conversation. I think we have here in the city of Tucson all of the resources and the intelligence with people like you to help us, you know, eliminate homelessness in our community. And we can do it. We need to get smarter. And so what I have seen is a couple of things. What I've seen during this COVID-19 pandemic is that it has highlighted all of the, um, the ills of our society have been um, magnified because of COVID-19. But also, it has forced us as a city in our housing community development department to try the housing first theory. And what we have seen from housing homeless community, without question, housing them to protect them from COVID-19, what we have seen is that many of them, once they get the help they need, we can move to transitional housing and much more permanent housing. And so we have seen some successes, some very good successes from having to urgently house houseless people in our community. And so I want for us to take from what we've learned during this pandemic and test out what Old Pueblo Community Services has been doing for a long time and has been a leader on. Um, and think how we in the city of Tucson can be a big part of that solution amongst uh, all of the nonprofits that we have that serve our community, but also with Pima County. We have to bring in the federal government into the picture as being part of the solution, as well as the state of Arizona as being part of the solution, because this is a huge issue and we have to work together in unity to solve it. So with that, I'm really happy that you have Julia here to share her knowledge with us. And I want to make sure that you all know that as mayor, I am committed to eliminating homelessness in our community. I believe in a housing first model, and I'm working with Liz Morales and Terry Galligan at the Housing Community Development Department to find strategies to build up more of the city of Tucson's housing options to provide bridge housing and permanent housing to our community. So thank you so much. I leave you with one thought. As we move forward in our conversations, we need to challenge ourselves. Um, we need to make sure that we're committed to solving homelessness rather than just managing it. And so as you start your conversations, think about the partnerships that we still need on the table and what are new approaches that the city of Tucson can take, and our nonprofit organizations and everyone involved in this call today, um, that we can take that we have not tried, um, that will help with solving homelessness in the city of Tucson and in Pima County. So thank you all for your time invested in it. And I look forward to hearing and seeing what you all come out with today.
Great. Thank you so much, Mayor. I
Thank you.
know housing, obviously housing first was a big part of your platform when you were running, and you've certainly been delivering on that in terms of, elevating what housing first is in the community, and how we can all work together between nonprofits, private sector, the city and the county. So really appreciate everything that you're doing to help support our efforts as well.
Thank you, Michael.
Um, so I'll just quickly introduce everyone, and then Julia is going to give us a presentation and talk for a little bit, and then we'll have a panel discussion, and then we'll take some questions. So certainly, Mayor, hopefully you can hang around for a little while, and feel free to chime in as we move through the conversation. With us today, we have three panelists, and then we have our kind of keynote guest. So we have with us today Tom Litwicki, who is the CEO of OPCS. We also have Brandy Champion, who is our Director of Supportive Services for OPCS. We've also got Terry Galligan, who's the Deputy Director of the Housing and Community Development Department with the City of Tucson. And as I said, we have Julia Orlando, who is the Director of the Bergen County Housing, Health, and Human Services Center. in New Jersey. Bergen County has basically gotten to functional zero, and they've fully adopted a housing first model throughout their system, is my understanding. So Julia is here, to bring her expertise, but also we've had a lot of conversations with her where she's really looked at what we're doing in Tucson and why we're in this really great position right now to kind of finish the job, I guess, is the lack of a better way of saying it. So with that, I'm going to first turn it over to Tom, just so for those on the call that might not be familiar with Housing First and with OPCS, Tom's going to do just a quick intro, and then we will give it over to Julia for her presentation. So take it away, Tom.
Thank you. Thank you to everyone on the panel. Thank you, Mayor, for giving us your time. I know you're very busy, and we're very grateful. The nice thing about having Mayor Romero on this is that she basically is able to give the Housing First presentation that I would otherwise have to give. And that's fantastic. The leadership and the understanding at that level is, I think, critical to the success of this effort. So if you're new to Housing First, this is one of these Google moments. If you Google Housing First, you will find lots of information. And if you look at pathways.org, you'll find lots of information. The best way, I think, to describe Housing First is in context of the traditional system of addressing homelessness in the United States and probably around the world. And that is that we would historically provide lots of services up front to people who are homeless to try and get them in some position of stabilization and what we thought was competent enough then to get into housing, and then we would move them into housing. Housing First and the initial studies that started this whole movement to Housing First highlighted the fact that that worked for some people, but it didn't work for a lot of people, and especially those people with lots of problems and concerns and were chronically homeless and cycling in and out of the systems. So they tried a bold approach, which was in hindsight actually quite obvious, which was put people in housing first. And if you put people in housing first, they'll start to stabilize because that's a basic need to have shelter. And then you can provide the wraparound services. So it kind of turned everything on its head. And it's one of those elegant solutions that once you see it, it becomes, well, of course, first you need stabilized housing, then you could work on other things. That would make sense in my life also. So Housing First is, the evidence-based approach that's accepted, funded, supported throughout the world today, and is the primary response to chronic homelessness. I think the other thing that the mayor mentioned that is critically important is this idea that we can solve homelessness, that this isn't something we have to live with. There are people now who their entire adult life they've lived with homelessness in their communities, but that's not the way that has to be. OPCS essentially is a Housing First organization. We provide housing. We also provide behavioral health services when warranted and wanted, and case management and support services. We work primarily with veterans, people who are coming out of incarceration, and people who are living on the streets. We've been around about 25 years, and we are always looking for community partners who are committed to Housing First and ending homelessness to join us. So with that, I will pass it on. And again, thank you everyone for your time. It's always wonderful to be here at these events. I think you're still on a mute.
Inevitable, right? Thanks, Tom. Yeah, we'll just, I'll go ahead and just introduce Julie again. I'll let you take it away, and then we'll have a discussion.
Terrific. Thank you so much for having me here with all of you. We are huge Cardinal fans in my house and huge Arizona fans. And although it's warmer here in New Jersey today than it is by you, I still wish I was there with all of you, and hope at some point in the future I'll be able to meet all of you face to face. I'm going to share my screen, and I'm going to be walking through a PowerPoint presentation with you. Okay. So you should all be able to see this.
Yep.
Okay. So the name of this presentation is Ending Chronic Homelessness, Yes, We Can, Si Se Puede. And hopefully by the end of my presentation, hopefully you'll all see why that is a very real possibility for Tucson and for Pima County. So this is one of my favorite quotes, that a clear purpose will unite you as you move forward, and values will guide your behavior, and goals will focus your energy. And I listened to all 3 of the webinars that preceded me. And this is what I heard from Tom, that the mission was to end chronic homelessness, not to manage it. And I just heard that echoed by Mayor Romero, that is very much at the heart of what you want to accomplish. And how do we do that? We do that by providing permanent housing. And why are we doing this? Because housing ends homelessness, and housing first removes barriers to housing. And so who needs to hear this message today? This is a motivated community that supports the efforts. And that's really where we want to get to today. Just gotta move my people pictures. So why am I presenting to all of you here in Tucson today, in Pima County? I'm from New Jersey. What could be the similarities? Maybe you think we're just this little tiny community in New Jersey and we're not similar at all. So this gives you a really good opportunity to look at us side by side. We're actually, my county executive said today, he's really excited because he believes we're going to hit a million on our census. And I know that your mayor knows why it's very important for communities to hit that million census, and we're real close. But so we're the same size. And if you look at our median household incomes, this is a very wealthy part of our not only of our country, but also of our state. It's very expensive to live here. So I want to disabuse you of any ideas that it's cheaper to house people here, because it certainly is not. You can look at the demographics, you can look at home ownership. So looking down here and also looking at the fact that you're the 2nd most populated county in Arizona, we're the 1st most populated county in New Jersey, and we're directly right outside of New York City. So when COVID hit and New York City, remember, was #1, we were right behind it. Before California, before anywhere else, it was New York City, and it was Bergen County. So I want to take a look at your data, and I just want to tell you that this was updated an hour ago. That's how fast things are changing in your community, and for the better. And I want to specifically have you take a look at the bold numbers, where you have 165 individuals have been housed just since April 17th. That is stellar. That's amazing. And not just because they're people, but these are chronically homeless people. These are people that have very, very complex medical issues and mental health issues, and very often co-occurring substance use disorders and medical things that are going on, and all these things, which makes it very challenging. And 165 individuals have been housed since April 17th. 500 total individuals have been served, which makes it 469 households. And currently, 20 people right now are in housing search with subsidy in hand, either housing choice vouchers or rapid rehousing. And Brandy tells me that on 11/2, 17 more people are picking up vouchers for permanent housing. It's mind-blowing, honestly. These are incredible statistics. And in fact, when I was meeting with this group on Friday, I asked Brandy, was there any potential that this data would change? And she said, absolutely. And it did. She housed another 2 people in the past 48 hours. One is an individual who actually is pregnant and will now give birth to a child not in homelessness. That is amazing work. So your bright spots and silver linings. these are some of the things that I heard from this team that really lets me know you're on the right path. Your housing placement increased during a pandemic. I think anybody would think your housing would slow down, right? Because for logical reasons. However, your housing placements increased during the pandemic. In fact, it used to take 120 to 140 days to house high utilizers of services. High utilizers are people that are in and out of the hospital, in and out of jail, in and out of shelters, people that are cycling through our system, right? It's hard to get our hands around them. So where it used to take you that long, you've broken it down into 60 days. You increased the collaboration during the height of the pandemic. So what that means is that you have a community that can come together and work together and make these outcomes happen. That's really important. People didn't scatter and work in silos. It brought them together. The cutting of the red tape, all those little things, the paperwork and the documents and all those things that get in the way of the housing, a lot of that was able to be dissipated during this pandemic. You have this move-on strategy, the opening of a low barrier shelter. I'm going to talk about low barrier a little bit. Providers being able to do their own housing inspections and doing their own classes for housing readiness has really sped up the process. Using a racial equity lens in assessment placements, brilliant, and cutting edge and best practices, and so important. And you're doing this with every person that you're meeting. You have this increase in political will. I mean, I just listened to your mayor. You couldn't ask for a better advocate for someone who's supporting your efforts. And that political will, as we've seen in my county, is so critical. Your housing authority is engaged and committed. That, being able to have that housing authority working with you makes all the difference in being able to really move the needle. Having these life skill classes to assist resettlement in the community and being able to have more willingness to take risks. I love when Tom talks about that risk and being willing to take on those high risk clients in the community that we all know. And the important things that you learned about homelessness and individuals experiencing homelessness. The most important thing I think we all learned was people are willing to go to housing. If you give them what they want, they're going to want to go to housing. And that really is the core belief of Housing First. Let's see. Oops, sorry, let me go back. So Phil and I were talking before we started the presentation about data. And he was asking me, do we use HIMSS data in Bergen County? We absolutely do. And it's so important to really take a look at having your most accurate data to really come to those conclusions about your homelessness in your community. Who are you serving well? Who are you not serving? Where are your challenges? Because that data informs the work. And ending homelessness requires that you collect data, good data, to analyze those services programs and understand your outcomes and make those improvements. You want to have a centralized, streamlined intake tool that can be shared across agency. And you want to decrease those duplicate records. We don't want to be counting people twice. We want to be counting them once. And really, what's very important here is that the agencies are sharing with each other. Because if you have agencies that aren't willing to share data, it's going to bring the whole team down. Everyone across these systems need to be able to share that data, especially shelter and housing. Because in my facility, and I'll talk about, we're one team. And it's very important that we're all sharing that data together. So my facility is called the Bergen County Housing, Health, and Human Services Center. So how it began is over 35 years ago. Our county initiated efforts initiated efforts to combat homelessness. So we had an emergency shelter, which was trailers on East Kansas Street in Hackensack. It was very dilapidated, bed bug ridden. It was not a wonderful place at all. And it really didn't serve our purposes. And the churches and nonprofit agencies were in the forefront of the community-wide effort to deliver these services. And they were doing the best job that they could. But Even for all the work that they were doing, homelessness persisted and the need for a more comprehensive coordinated approach was recognized. Okay, so these were our challenges, and listen to see if some of these are related to some of the things you might be seeing. Number one was identifying resources. You know, these things take money. Luckily for us, one of the silver linings with COVID is that we do have resources now, and we have to take advantage of those resources that we have at our disposal now to really make an impact. Secondly, is this resistance to the housing first model. There are many people throughout the country, unfortunately, still resistant to this housing first model. And I think the problem there is because they think housing first means housing only. And housing first does not mean no services. It means that the first thing we want to do is get people into safe housing and attach services to them. And what I can tell you, having done this work specifically with the homeless for the past 11 years, is if you don't give someone what they want, no matter what you say or what you do, they're not going to change. They're not going to leave their current situation. So we needed to really work with our community to help them understand that this housing first model really was something that needed to be adopted if we wanted to end homelessness and not manage it. So the community mindset was focused on that, and we needed to change this to ending it. And a fear of change. I think providers were afraid, if we do this new model, am I going to become obsolete? Am I not going to be have anything to contribute? Are we going to lose our funding? So that's an important thing to realize, that if anything, there's more opportunities because you're getting more of the work done. And also, of course, that agency investment in the system as it was, by feeling like, if we're doing something different, does that mean I was doing something bad? And it doesn't mean you were doing something bad. It just means that this is another part of the work we're doing to really address that chronic homelessness that other methods have not. So this is our response, and you can see that it's gone from 2002. We analyzed our existing shelter system. And what really came out of interviews with 200 stakeholders is that we needed to have one permanent place where people could come to get these services. So there was a county collaboration with the United Way, and we developed a pilot to do housing first, kind of like what you guys are already doing there. We had this opportunity to really test it out in the community and see and fix all the things that didn't work and find out what we needed to do differently. And then in 2007, the HUD and the county funding aligned, and we did this building plan to revise our existing shelters to a one-stop. So basically what we did is we took 4 shelters, eliminated all 4, and put everything into one facility. And in 2008, we developed this 10-year plan to end homelessness. And in 2009, this building is developed and for this low barrier shelter. And then in 2010, I developed the Hackensack Collaborative Outreach with all of our business partners and other services within the county seat to really bring them in to the work that we were doing. And I'll speak to that a little bit later on. So this is our transformation process. You see that leadership commitment to ending housing, homelessness, your integration, the agency engagement at every part of the process, and then restructuring your local funding to support your new system, and then getting your technical assistance and support for program excellence. So what we looked like before is we had 4 temporary shelters. A lot of them didn't even have beds, they were sit-up chairs. People using substances were banned. They were difficult to get into, they were difficult to access, and because a lot of times people weren't leaving. They had 4 different intakes and limited housing access. And something that upset me tremendously is only 8 beds for shelter for a community of 1 million people. In our new system now, which is a housing first model, we have this newly constructed facility. Why is that important? Because if it's not clean and it isn't welcoming and isn't safe, people aren't going to want to go. So we are now open 24 hours, 365 days a year. We're low barrier. We use coordinated entry. We prioritize immediate access to housing. And now we have 45 beds for women. So in this facility now, this mission is to end homelessness by providing this full continuum. And this facility now is the key feature in our 10-year plan to end homelessness, which sunsetted in 2018. And I think we're one of the few communities that actually met the goals of our 10-year plan. This is our beautiful new building. It looks like it belongs in Tucson. It actually is quite beautiful, stucco exterior, very welcoming. So when you say homeless shelter, this is our homeless shelter. This is our 27,000 square foot Bergen County Housing, Health, and Human Services Center. These are some of our pictures. It's still a shelter. You know, you see the shelter beds, but we have nutritional program. We do 73 meals a year on site. We provide showers and laundry and mail service and computers and telephones. We have nurses on site, and we are the command center. And so even during this pandemic, when I had to close the shelter and put people in motels, we're still working out of this facility because we remain as the command center. So the best practices of a low barrier and housing focused shelter are actually using housing first, reducing barriers, having that persistent, coordinated, creative outreach, engaging and supporting with your housing authority, holding partners accountable. I talk to our partners every 2 weeks, all 40 of them on a Zoom call, holding them accountable. What's going on with this person? Did we get this document? How come that voucher didn't get signed? What's going on with this landlord? Every 2 weeks and daily in other meetings and in other opportunities. Using really good assessment tools. I know your assessment tools are very good. Using our community-wide lists, always monitoring their progress, and having that rapid exit to permanent housing and using surges. Brandy did a surge this weekend. I said to her, can you push that number? Can we get to 500? She did it. She did a surge with her team. She did that battle cry. And surges are very important, especially during times like holidays or when we're going to have inclement weather, when we really want to push those surges. So the reason I've been invited today to talk, because you could have a lot of people come talk about housing first, is the idea of getting to zero, that it really is something that a community can do. And ending chronic homelessness takes political will. It takes leadership, collaboration, and coordination among multiple state and local programs to align resources for housing and for supportive services. In order to do this, you have to work together. You have to collaborate. Now, collaborate doesn't mean you always like each other. It doesn't mean you always get along. It doesn't mean you don't disagree. In fact, good collaborations don't all agree. The whole idea of collaborating is you're bringing in different ideals, different problem solving, so that you're working together to most effectively find a solution to a complex problem. That was really the idea behind the center, because the center, which is owned by the County of Bergen, they didn't want to replace the services in the community. They wanted to bring them together and give them a place to do that. So we really have become this focal point and single location for everybody to come in, and everybody can get an office when they need one. And most importantly, they can find those individuals that they need to work with, because they're either getting a meal with us or getting a shower or having a meeting. They can find them. They don't have to be out on the street looking for them. We know where they are. So I wanted to put some pictures to the team. I'm representing this big team. It's 32 county-wide providers of our continuum of care. This group really tremendously has enabled the county to coordinate efforts and resources and maximize the benefits to any household that's experiencing a crisis in the county. So this is our county executive, Jim Tedesco. I would be remiss if I didn't include him. And I love what he talks about when he says that this is an effort that required all hands on deck. We started with the principle that everyone deserves a home. For the chronically homeless, that first step of secure, stable housing can be an incredibly difficult task. This is why this work continues. Now, I work for the Housing Authority of Bergen County. So we have these shared services. So having these shared services with the Housing Authority, where I'm able to manage the administration of the center with the theme of housing omnipresent. It's always there. We're always talking about housing. And they commit vouchers, whether they're HCVs or it's HPRP or it's ESG or whatever we need to get people into housing. So I share this with you, and it's a little bit of me bragging, but I'm going to brag a little bit, because when you get to functional zero, some really, really awesome career-changing things happen, like the White House. Like you get invited to the White House. So the picture below is the county executive and I at the White House. We were invited by Michelle Obama. The letter is on the left. I mean, it really doesn't get better than that when you're at the White House and the head of the Air Force shakes your hand and thanks you for the work that you've done to end veteran homelessness. I mean, seriously, there's no greater day in your life, except, you know, when you have your kids, than when your country thanks you for the work you're doing. It is unbelievable. And the top letter was the confirmation that we were the first in the country to end chronic homelessness. And you know, I think at our press conference, we were all crying. I was crying, my husband was crying, the county, we were all crying. It was such a moment of achievement that this really can be done. It's not enough to get to functional zero, you have to stay there. And believe me, sustaining it is harder than achieving it, because it's like having this, you know, the gold medal, and you don't want anybody to take it away from you. So what that means is that if anyone shows up in my community as chronically homeless, we have to house them within 90 days. We have to prioritize them, get to them first. We actually did have this happen where someone came off the street after being in the woods for 16 years. He did not want housing, would not work with us, and something happened to him this year, and he finally decided to come in. It was wonderful. And then the pandemic happened, and I thought he'd get scared and go back, and he didn't, and he stayed in the motel, and we got him a COC voucher and housed him. And I just learned this week that he was just diagnosed with stage 4 colorectal cancer, and we are now working with him. And he wasn't housed for long, and now he's getting really good care. And we don't know that, we don't think that he'll be able to return to his home, but he's not going to end his life as a homeless man. We were able to give him what he wanted when he was ready, quickly and swiftly, and be able to deliver the services to him. And that's really what this work is about. I hate this picture, but I included it because this actually, if you can see the bottom of it, it says, you can do it. Si se puede, right? Yes, you can. We're proof that anyone can get there. And really the message is that we did this here in New Jersey. This can be done. Chronic homelessness has been ended by 2 other communities after us, Rockford, Illinois, and Lancaster, Pennsylvania. So we know that in this country, this work can be done. You are so well poised to be able to do this, and we're going to be talking about that in the next section of our presentation together in our panel. And this is me. I invite you to follow me. I'm on Twitter, I'm on Facebook, I'm on LinkedIn. I post lots of articles on homelessness. So please feel free to follow me. And that is my presentation, and I'm going to turn it over to Michael. And I'm 20 seconds left. Okay.
Good job. No, that was great. That was perfect. And you know, a really great introduction to kind of our discussion that we'll be having. And I appreciate all the time you put into that, Julia, and the time you spent with us. We would mention we were going to have Julia come out in the spring when we were originally going to have this event, and then obviously everyone's world changed. So we're glad to finally have you with us in some way. And certainly, yeah, once we get through this, you know, we'll invite you back out again.
Thank you.
Some Arizona winter.
Mm-hmm.
I think coming off your presentation, I think, you know, one of my first questions is, and this is really probably to the whole panel, you know, what is it really that's putting Tucson in a position to end chronic homelessness? Because I know we all, I think on this panel, feel like we're almost there. So if we could just talk about why we think we're there.
You want me to start?
Mm.
Okay. I think first and foremost, you have some political will here. What I've learned is that you have to have political will behind you, because this is a rocky road, and you need to have the strength of your visionary leaders behind you. And you have that. You have political will behind you. And that's a big piece of this. And I also think that you have the drive. You know, I listened to the other webinars, and the drive and the passion to do this work is there. I also think that you're utilizing best practices. You're diving right in. I mean, Brandy and I, she was telling me about even some of the harm reduction things that they're doing. I mean, they are out there doing the tough work that you have to do. And if you're not willing to do that, you're not going to see zero. You have to be willing to deal with the most challenging folks, and be able to really meet them where it's at. And I think that lastly, I would say you have a demonstrated success. It's working. What you're doing is putting people into housing, and they're staying there. It's really, you've done your own pilot, and you've shown that what you're doing is working. You just need to continue to do it and have the support around you to finish the job.
Mhm. Yeah, maybe Tom from the inside. What are you saying?
Well, I would echo some of what Julie is saying. This, political will, I think, is critical. And with that, the leadership within the city, departments of housing, and with the county, Pima County, have really understood and logically have embraced this model. And so I think that's really critical. Along with that, I think in working with our chief of police, our sheriff, our fire department, it's always grateful that people, they get it, they're on board. They don't have a lot of, one of the, I think the nice things about Tucson as a city and Pima County is that there's maybe less hangups in some areas of, should we do this? Because it's a pretty giving community. And so I think it's about just having that knowledge that this can be done, and that we have these resources, and this is how we could put them together. For us, I think all of that, it's my observation when I first started in this role 6 years ago, was that in going around to places, and when we met Michael, was that, gosh, there's all these pieces. It's just about how do we put this puzzle together? And gratefully, a lot of these pieces still have capacity. We still have these vouchers. We still have these. My first reaction was, wait, we have these vouchers, but there is another side to that we have resources that we haven't even tapped into yet. And so the opportunity to do that, I think, is amazing. When I first had a meeting with the city manager, and you were there, Michael, he said, what is it that you want? And we basically said, we don't want anything. We just would like to link up what you have, demonstrate that it's successful, and then we can talk about what's needed. But we don't need anything right this second. What we need to do is just link together and work together. And I think that's really great. I would also add that the Tucson Pima Collaboration and Homelessness, which is our continuum of care, has put forth 6 years worth of work at trying to reduce bureaucracy, and are just now at this wonderful point, and I happen to be on their board, so it's kind of an inside plug, but at this point where they have a real vision as an organization and are able to start to coordinate those resources. 6 years ago, it was more of just a kind of bureaucratic, what Julie had mentioned earlier, this idea of, how do I keep my model going? How do I keep what we're doing going? Which is good because you're trying to do good, but the solution is systemic. And so we have to have, it's a systemic problem, and we have to have a systemic solution. And so there's a lot. I think a lot of communities come to this point and have to convince government, or especially police departments and places like that, to get on board. they're in some ways ahead of us. They are ready.
Yeah, absolutely. Our webinar with criminal justice reform, that became really clear talking to the assistant chief. And I don't know, Terry, from the city side, and what are your thoughts on kind of where this is going?
Well, I just would echo what both Tom and Julia said. I think what's really, I've seen a major shift. The city of Tucson Police Department now has the homeless outreach team, and a lot of people on this call probably know Sergeant Jack Julesing. I think a lot of, just like Tom was saying, a lot of these pieces are now are starting to come together. And, the county also is on board with this. They did the Pima County Housing First. They've invested over $3 million into Housing First in the last 2 years. So I would just say that the political will is there, and now it's just trying to get everybody to work together and put those pieces together. So I think we do have, a lot of the best practices down, and we just need to keep moving forward.
Yeah, absolutely. Sort of this, it's almost like the stars are starting to align in a way that we could actually move this across the finish line. But so Brandy, you're kind of on the front lines, I believe, more than the other rest of the panel. As we're trying to do this, what are the obstacles that you're still seeing in our community that we need to work on?
Actually, I saw I just want to touch on a few things that Julia touched on, and it's mostly about the collaboration of things, cutting of the red tape, and bringing everybody into one room together to talk about these cases and hold each other accountable, right? So I saw a lot of obstacles before the pandemic, but in this pilot of the Viscount that we've been doing, I'm seeing the red tape go. And this is how we've been able to do this amazing housing number. We have a bi-weekly call, just like Julia said that she's doing in her county, with the city and the county coming on board together to go over each client. So what are you doing about this person? Are we referring this person to a voucher? Or are they going to rapid rehousing? Having those discussions, and all of the agencies and collaborators coming into one room together. Also the city relaxing some of their, document requirements and stringencies that they've had in the past. So this Viscount has really been a pilot to test out, can we do this? Can we remove some of these obstacles that we saw before? And it's worked out beautifully. So.
Yeah, it's been a really successful program, and I think a lot of people questioned how that was going to go when you moved 200 chronically homeless people into hotel rooms. But we'll talk about that a little more in a bit. You brought up the pandemic, which obviously that changed everything for everybody. But and maybe Julia, from your perspective, and even kind of what's happening in New Jersey. I know you said something really interesting in one of our conversations. You were talking about how COVID's not really the crisis, it's homelessness that's the crisis. And what the pandemic has done is just made us focus on it in a way that we weren't willing to before. So I don't know if you want to talk about that just a little bit.
Sure. I mean, think about what was the first thing we were told? Stay home. How do you stay home if you're homeless? You can't stay home. And so, I know in the beginning of this crisis, I thought, wow, the worst thing for a homeless person, what's worse, being in a congregate shelter or being on the street? Like, they're both really bad. And they're not just bad for them, but it's bad for us. It's bad for your community. So it shed this light, but we can't go back. Because the crisis is homelessness. Because if we didn't have homelessness and everybody stayed home and everybody was able to do that when we needed to do that, we wouldn't be where we are today. I always look at, a pandemic, like this idea, I look at everything as what's good about it, right? What opportunity does it provide? And what we learned, and I said this during the presentation, is that people do want to come off the street. And I think some people are very comfortable saying, oh, people are choosing that. they're choosing to stay homeless. They're choosing to live on the street. But what we learned is that if you give someone an option that they want, which is, think about a motel room. A motel room is not a shelter bed. A motel room is your own room and your own bathroom with privacy. Look how many people wanted that. I mean, that teaches us something about maybe we have chronic homelessness because what we had is not what people wanted. They didn't, even if they could be in the shelter, they don't want to be in the shelter. And that's for many reasons, whether, and very often, yes, maybe it's a mental health reason. Regardless, the issue is really getting them off the street. The other thing is that we can house people faster than we thought. Brandy's referring to like in the chaos was great for people like Brandy and like people like me, because it was like, just let us do our thing. Like, isn't it great that we don't have to do X, Y, and Z, right? We can just get people from here to there and I don't have to worry about a lot of things. So what did we learn? What we learned is get out of people's way. Get out of the way of the people who know how to do this. Let's support them. They need support. They don't need to, we don't need to have 15 different things in the way of people who are trying to do this work. I really think that, and lastly, what I'll say about this is the pandemic taught us urgency that we should have had already. And the reason that Bergen County ended homelessness was because I pushed that urgency. I made the homelessness urgent. COVID made homelessness urgent. It doesn't matter where the urgency is coming from. The message is that it's urgent that we get people into housing, because I know that Brandy and Tom and everyone else in this call doesn't want to take those people in motels and put them back on the street. No one wants that. And the only way they're going to be able to house those people is by having the resources and the support and not having a whole lot of things in their way to make that happen. It's really kind of simple when you break it down, but doing it is complex, as these folks know. But we need to bring that sense of urgency, and we have to hold on to that.
Absolutely. And I think, something else Brandy mentioned, I think you're saying as well, in the chaos, you were just able to do things. And some of that was the red tape reduction and basically, getting out of our own way. So Terry, a lot of how the Housing and Community Development Department works, you can change your policies to be able to help streamline some of these processes. And obviously we have done that, and the department's done that. I don't know if you can talk about that reduction and if there's other ways we can streamline this process further.
Well, the first thing I'd say is that, just our department, did pay for the hotels, which was a huge investment. So I think that that's made a huge impact in getting so many people into one site. And then what happened is once they're there, then you can work with people. And that's probably what we've learned is one of the hardest things to, once you get people into bridge housing, is getting them ready, voucher ready, and then finding an apartment. And so what the Housing and Community Development Department did is we did cut down on a lot of our red tape, and we made some exceptions on, Social Security cards. We could, ask that they provide that after they get housed. So there's some of those things that have been done. I think one of the things that really helped a lot was allowing the OPCS and other agencies to do the housing quality standards inspection, because that was slowing things down a lot. So what we've learned is, again, it's an opportunity for the partners to come together and brainstorm and find what are the obstacles and how do we overcome them. And I think what's been great about the hotels, there's been a lot of good partnerships, not just with OPCS, but Community Bridges, Primavera, Catholic Community Services, El Rio. So it's people all coming together and trying to tackle these issues. And I have to say that the hotel providers have been also quite helpful and very cooperative. I know that one of them was already mentioned here. The Viscount has been great. So I just want to acknowledge that this is where you have to have, obviously government plays a big role in this with the Section 8 vouchers and things like that. But this is also an example of the private groups coming, coming to the table. And, the circumstances are unique, but it does show, like, who would have thought that we could, go out and get 3 different hotels and have this many people congregating in a hotel and have things run so well and have such good cooperation in the community. So all of it all of us working together can make a big difference.
Yeah, I would agree. I think the hotel, again, it's sort of this, rapid experiment. I know, Brandy, if you can talk a little more about just, I know we had a whole webinar on the hotel experience, but if you want to talk a little bit about, how that's been working and, and just the kind of success it's been, because we have moved a lot of people into permanent housing.
Absolutely. Just wanted to go back to something that Julia said, and that was, do people really want to be on the street? And the answer is no, but they want to be able to bring their pet, and they want to be able to bring their significant other, or whatever they're bringing with them, their belongings, and not be limited to those belongings. So I think that that's been important. We have had a lot of people bring in their pets with them, their significants, their children, what have you. There's not always shelter options available for families. Let's say they fill up pretty quickly, the family shelters do. And so this has been tremendous. We've seen 5- and 6-person families with a couple of adult children in there. And, there's all these stipulations at your normal shelter places, well, your adult kids can't come with you. Well, why not? They're part of our household. So I think this is what we've seen at the hotel, and removing some of that red tape, like we talked about before, has been tremendous. It's and we, we didn't know what to expect going into this being a new thing. It's been really successful. I mean, we haven't had any more problems at the hotel than you would have at your normal shelter. And it's been a lot more free, so to speak. People to make their own decisions. People are wearing their masks, they're social distancing, they're following those types of guidelines. They're not room visiting as often as you would think. They're not bringing outside people into the hotel as often as you would think. We're just not seeing what we thought we would, because we set the tone from the very beginning. And it's been really successful.
Yeah, but to that idea, you just treat people with respect.
Absolutely.
And dignity, that they're going to respond in a way that hopefully improves, their life and ultimately improves our community. I think, I guess the other thing I took away from you were just saying, Brandy, is that this experiment kind of it fundamentally proves and shows that we can change the way we handle shelter that is going to be more successful. So, with simple things, allowing pets or allowing adult children, allowing people to shelter together clearly is going to produce better outcomes than what we've been doing for the last 30 years.
Absolutely. Absolutely.
So I think one of the questions, we've thrown around is, we're still in the pandemic, and it actually feels like, cases are rising, but, eventually, this is going to pass. How, like, what do we want to have happen? Like, how do we take what we've learned and sustain it? Like Julia was saying, we really, we're moving in the right direction, but how do we sustain this momentum when that urgency of this outside, the pandemic is gone? Let's open up to anybody.
I know for me, this emergency, really creates a situation where obviously you say, well, we just need to do whatever we can to accomplish this goal. And I think that's the urgency that we need to keep going. I think the critical piece is the infrastructure that we put together in this emergency, and to keep that structure together. And so, right now, the city and the county and providers are in agreement on the goals and the mission, and they're communicating continually, and they're coming from the approach as if we're on the same team, and we're trying to accomplish the same goal. And we're aligned in that sense, and emergencies will do that for you. And then, you get out of an emergency and people start becoming a little more territorial again. Well, we have to do this, we have to do that, we can't make this or that exception, and we start having different goals. And I think that's the critical piece. Part of me, part of I think what I'm want to do, and I think everyone can do, is to keep this sense of urgency. I think there's always been homelessness is a crisis, and it has been a crisis, but we often don't see what's happening because it happens somewhere else. It happens in hospitals and shelters. I don't think, we've been working with the medical examiner's office, and our team has been gathering information of people who die in the community. I didn't know that in the last fiscal year, 72 people died homeless in the streets, in desert areas, found in fields, taken to the hospital or out of a shelter and then died. And what's really fascinating, and I think our biggest challenge is going to be this getting rid of this red tape, because 42 of those folks, 58% of those folks, were in our homeless management system already. They were assigned someplace, they were waitlisted for something, or they were matched with a provider, but the provider couldn't find them. And so people were out there for, some of them up to, a couple 100 days, 300 days, that were out there and still on these lists. And I think something the city's already just put out is this idea of, we need to coordinate that whole entry process. We have a coordinated entry system, and it's reduced a lot of bureaucracy, but we really need to shift to an emergency system that says, I have this person, they're on a list, they need housing, we're going to get them housing today. I'm not going to then send that to another provider who gives it to an employee who then makes a call and looks for them again. What's funny about having people in HMIS, and one of the strange things I noticed in this work, was that we went out and counted people who were homeless. And I was fairly new to this work, which is a blessing sometimes, because you can see things like, what? We went out in the middle of the night and early morning and counted people who were homeless, and then spent a year looking for them to give them housing. It's like, well, wait a minute, we already had them. We had the voucher. They did the screening. Let's just do this other screening and move them into housing. We've got everything. We found them. But then we had to find them again. And so these kind of repetitive traditional systems, if we can turn it into what Julia mentioned, this idea of a command center in which we have that sense of crisis and urgency, that we're all on the same page, and we're trying to keep people from dying on the streets. And a lot of times those barriers are things like, well, they want to stay with their partner. And when you really start to learn what's going on, well, it makes sense, because their partner is elderly and has dementia, and they don't want to just have their partner. They don't want her to go to the women's shelter and then maybe get lost, or why would they trust someone to keep track of her? And will they see her again? Or will they lose her? So of course they'd rather live in the wash than take the chance of losing their spouse. And so there's all these, anyways, I could go on and on. But that whole idea of urgency, and this idea, someone told me a couple of years ago, I hadn't thought about it, because they said, Tom, you're doing noble work. And he said, you need to remind your staff, they're doing noble work and they're saving lives. If we could move someone through this coordinated entry system sooner and quicker, we have saved someone's life. We might not get to know which one, but it's literally saving lives. And I think that everyone's in it for that as their purpose. They really don't want to see people dying in the streets, especially when we have the resources to get them into housing.
I would piggyback on that. What you're talking about and what Brandy was talking about is the 3 Ps, the pets, the persons, and the personal belongings. And because you're allowing those 3 things, and you're giving people these motels or hotels or they are really valuing what you're doing for them. And Brandy, that's why they're not behaving as badly as we expected, because they're like, I really like this. Like, this is really great. I really appreciate, and plus don't forget, Brandy, you're also bringing them meals. Don't forget that. That food is a very big thing for persons experiencing homelessness, right? So you're giving them a safe place, a private bathroom, meals, support, they can have their stuff and I mean, you're giving them what they want. And so we've discovered the end to homelessness. You've just got to take this to scale, right? It's taking this to scale. So where we are now is, I think you ask for the commitment. I think that you've had your community listening to this, to your webinars. You need to ask for those, like, who's in? Who is in? Who wants to do this work with us? And it's something important that I found in my journey was that in every sector of your community are rock stars. Like Brandy's a rock star, right? We all know that. You can tell, I can tell already. Brandy's a rock star. Are there other people like Brandy in other sectors? Yes, there are. I bet you she knows who they are. We need to put these people together, the people with the excitement and the mission and the drive and the willingness to do the work, and put those people together. It's a little like gremlins. Just throw some water on them and watch them grow and expand, because when you put the right people together, they really can make this incredible change. And it's one person at a time. It really is. This work is one person at a time, because we talked about, you know, Brandy housing this person over the weekend, but she said, but you know, I go, oh no, I know how much work there is, but you finish the job. You close the deal, you finish the job. So putting people together, asking people to make the commitment. I have a task force to end youth homelessness. You can't be on my task force if you don't write out your commitment. You have to put it in writing what you're going to commit. And I'm going to remind you of your commitment when you're not doing what you offered to do. So there's almost a formal process here. The other thing is, you know, you have people like Terry and people like the mayor who can celebrate these victories. You have to stop every once in a while and go, hey, we helped 500 people. Can I get a shout out? Can I get a recognition? Because agencies need that. Because what happens when you work together in a collaborative, you lose that silo, but you also lose your identity a little bit. And we need to give that back to people and say, you know what, this agency, you know, Joe's agency, fantastic, helped us move 13 people this month, or provided this resource. Like we need to make that, we need for people to know about that and to really celebrate, because what happens is it becomes a momentum and people want to be part of that exciting momentum. And the last thing I would say on that is, when you talked about the people that died, we honor Homeless Memorial Day every year at our facility. And it happens on the winter solstice, and it's a national day of recognizing the people who have died in homelessness. And we read the names of those people at one of our nightly dinners with our mayor and our county executive and our commissioners, our freeholders. And it is an important thing to do, to be like, okay, and these people, either they were homeless and they died in their housing, or these were people that we couldn't reach. And it is a somber remembrance of why this work is so urgent and why it is so critical. So just another thing to maybe think about this year.
I just want to piggyback on the celebration. I forgot to mention one of the partners on the hotels was Sullivan Jackson Employment Center at Pima County, who've also done an excellent job. So I like that idea of, we should be celebrating how well everybody's worked together to get this many people housed. The one thing I just say really quickly about the question, going back to next steps, I like what the mayor said about getting smarter. I think we all do need to get smarter. And, I kind of go back to my community organizing days, where we need to have organized people and organized money. And, the key word there is, the money is key, but organized is also very key. And, with that, we've had this influx of money, and I'm excited just Yesterday, the city put $2 million out for a request for interest for rapid rehousing. That just, we're looking for agencies that will partner with us. And that's going to be targeted towards the people that are in the hotels. We also put out $150,000 yesterday for partnering again with not-for-profits to help them hire maybe 2 to 4 navigators, because I think that's another thing that we're finding, that organized people is that people get into the hotels, but it is a heavy lift to get them from the hotels into their own apartment. And the bureaucracy, which, you know, the city's part of that with the red tape, they do need a lot of hand holding. So we're putting the $2 million out for the rapid rehousing, but we also recognize that some of that money can be used for the navigators case management. But in addition to that, we're offering another $150,000 for agencies to hire other navigators beyond the hotel program. So it's about organized people, organized money. It's about getting smarter, like the mayor said. And I think we have the pieces are there. It's just putting the puzzle together. So, but I do want to emphasize that we should be celebrating. I think today, this Housing First Forum, I look at it as like a culmination, and it should be a celebration of what's happened and the great work that all these agencies have done, and the Pima County, City of Tucson, and the private businesses who've all helped. So thank you, everybody.
Yeah, absolutely. I think one of our conversations to prep for this, Julie had mentioned how much we've already done as a community. And I think sometimes being inside of it, we can't even see what we've done, but you know, it takes somebody from the outside sometimes to just look at the data and say, no, look, you've done amazing things already. And Terry, you're right. I think the momentum's building within the city to be able to fund these programs in a way that can have like meaningful impact and continue to move the needle. Let's see, so we've got about 15 minutes left. I will ask a couple more quick questions, and then we do have a couple of questions from the attendees. One thing just to touch on is, you know, obviously we're working with some people that can be very challenging. And with that, I think comes a certain level of risk. I think some of maybe the fear, Julie, that you mentioned in your presentation to adopting these changes is, you know, is assuming that risk. And again, the hotel is a great example of, you know, we went into it not knowing what was going to happen. There was a lot of fear about how that was going to go, and those fears weren't played out. So I don't know if Tom, you want to start, or even Brandy, like how do you factor risk into this equation, you know, as we try to sort of approach ending homelessness?
Well, it's interesting that you mentioned that, because as an administrator, you know, risk is always up. What's the risk? And of course, if we, as the joke is, if we followed all the advice of our attorneys, we would simply do nothing quietly, so no one noticed and we couldn't get sued for that. But this idea that these worst case scenarios going through our minds about this sort of thing. And when we first started into Housing First, that was our risk. And we had to think about that. And we went into the hotels, we still had a little bit of that, but luckily we had experience. And what we found out very quickly, and we found out since over the last 5 years, is that a lot of that risk is, in our experience, is unfounded. It's fear. It's not really risk, it's fear. And you know, taking that risk, I think, is important, but when it really comes down to it, we really haven't taken a bigger risk than we were taking before. We don't see more problems or issues in our low barrier housing or the hotel or other places than we have in the past. We have maybe more health conditions, but we don't have those problems. You know, the places have not gone up in smoke, and I think that's really important to note. And you know, for us, I think the risk, there's a lot of internal risk. I think it's really interesting that Julia was mentioning about identity and that. And I was lucky enough to come into this without a long, you know, history, 30 years or 20 years of working in homelessness. So maybe there was less to throw out the window for me. I was looking at it kind of new. But the benefits quickly begin to outweigh the risk. And in no condition is it better for someone to be homeless. And a lot of our staff, we've worked on the idea that we might be taking a risk in housing, and it's a calculated risk, but there's no way it could be better for our community and the neighbors who pay taxes that support our work for us to discharge this person who is in mental health crisis and intoxicated. That's certainly not the right thing to do. So we're going to have to take the risk because that's what we're getting paid for. And once that happened for us, and once places did not burn down, that fear subsided. But we had to kind of take that first step. Brandy, I know you've experienced that at the hotel. One of the funny things is we were talking to the hotel when we first got in there, Brandy, as you recall, with the hotel staff about the kind of things people might do around drugs and things like that. And what the hotel staff said, oh, that sounds like our hotel customers. I mean, people are people. It's not like homeless people invented the idea of using drugs, you know? So it was a real, they were less worried than we were.
Yeah, I'd have to agree with Tom on that one. They, even through all the things that we've run into at the hotel, I mean, the lady that's been there 20 years says, yeah, this is nothing. She says, our regular paying customers are, yeah, this is the same. So I think as far as the risk goes, I think just putting those harm reduction things in place, Michael, has been big for us at the hotel, establishing right off the bat, okay, we're going to use masks. This is, you're here because you're at risk health-wise, you know, so we're going to use masks in common areas at all times. We're going to do social distancing. We have signage up right away. We established those things. Having the nurse on site was very helpful. We had our outreach nurse from El Rio coming in and screening these clients, doing light wound care, just collaborating to reduce risk, you know, having naloxone kits on property, and coordinating with Christopher over at the Sonora, you know, the people that distribute the naloxone kits, having them on board and making sure that the clients know how to use them right off the bat. You know, you're just doing the best that you can with the harm reduction and all of this.
Back to what Tom said, it's, you know, it's better to have someone at least off the street and, you know, in some kind of shelter or housing than leave them on the street in those kinds of conditions. Brandy, question for you, and then maybe we'll answer a couple of the attendee questions. Are there any, just to kind of put a little bit of a face on this, are there any recent clients that you would kind of want to share their story with us?
Yeah, we had a couple that has been chronically homeless for about 9 years now in the community. I know that Old Pueblo's been doing outreach with them since around 2013. The gal's in a wheelchair and the significant is her caretaker. And we've really tried to get them in housing. A lot of different agencies have worked with the couple. And we had them in the hotel from pretty early on. We opened the hotel on April 17th, and they were there fairly shortly after that. And we were working on getting them into housing. I mean, this is a perfect example of housing first. We couldn't get them through any housings because of their ID barriers. So they had a lot of, she's from Sonora, and she's here legally, but she had other barriers to ID and such. And there's a little bit of mental health going on. We finally got them housed. And I mean, we visited them in their home the other day, and they're just relaxed. I mean, to see them just relaxing and enjoying a meal under their own roof is, I mean, they were living basically at a Santa Rita Park and all over for the past 9 years. So it's just wonderful to see them housed and stable at this point.
That's great. Yeah. And I'm sure there are a lot of stories like that.
Yeah, there are.
We'll answer a couple of the attendee questions. This is from Sarah. It's actually interesting because we've talked a lot about the nonprofits and our agency and the city and the county. Julia, they're asking how do you engage with the business community? How do you get that fourth leg in here to support this?
So when I started at the center, the first two groups that I met with, I said, I want to meet with the police and I want to meet with the business district. And I put a suit on and I went to one of, contacted them and I went to one of their meetings. And I said, tell me what you don't like. Let me have it. Like, tell me all the things you're upset about. And then I told them my vision. And of course, they thought my vision was crazy because, ending homelessness and getting all these people off the street and getting rid of the squeegee people and people on the benches. And so the first thing was really engaging and listening to them. And I think what happens with homeless providers and the business is we want to house people because it's the right thing to do. And business owners would like people to not be on the street because it affects their business. And we look at them as if that's bad. And it isn't bad, because really what matters is the common denominator, which is we don't want people on the street. Does it really matter? Why? We have to stop making people agree with us or see our way. My thing was, hey, we all want the same thing. I can do that, but I'm going to need a little bit of help. So initially they wanted to buy a van that I could go out and put people in the van and drive them away. And I was like, well, that's really not what I'm going to do. But let's keep brainstorming and talking about things. And I'll just give you one example. One of the reasons people were in the city of Hackensack a lot is they were being fed by restaurant owners. So I went with the mayor and I met with all the restaurant owners and I said, hey, did you guys know that we feed people down at the facility every day, 3 times a day? And I'm going to give you a card with our address on it. And all they have to do is come down and present the card and we're going to feed them. And what this did was it let us count the number of people that we were outreaching to, but also it gave the business owners something to give the person because it was hard for them not to feed them. And we started to change the way people behaved. So change really comes from collaboration and talking and wanting to do something a little bit different. And what's really funny is that if you look 10 years later, when we were celebrating our 10-year anniversary of all the people we housed and all the changes we have made, Terry, the people who paid for our party was the business district. And I just thought, wow, we really have accomplished, like they were thanking us by paying for our celebration that we had in one of the restaurants of the business owners. So I think it's really important to involve them. And now I have a meeting every three months. I have a meeting for the past 10 years that includes the business district. And don't you know it, now they offer me apartments, they offer me jobs for people, but I had to listen to them first. How can I help you first? How can we help each other in this goal? Which Tom, is very good at explaining why this benefits everyone. Having that couple, people are going to notice, Brandy, that those people aren't on the street because they are a fixture. And everybody knows. And when people start to learn, wow, you house them, how are they doing? And now they become part of their community, but in a much more positive way. And I really think that's the merging of the community with the services.
No, yeah, absolutely. Let's see. The other question now from the attendees that Sarah asks, what would you say to neighbors who are seeing more homeless on the street and perceive that services are limited or not desired by those experiencing homelessness?
Who's that question for?
Just for the panel. So.
I'm going to let Tom, do you want to start?
Sure. So for us, my answer always to people is call, especially if you've got somebody who's regular to your area, is call, 546-0122. Look us up at helptucson.org. You can send an email, and then our staff will contact Brandy, and Brandy will send out outreach staff. Whether people seem like they want the help or not, the first thing is to get somebody to offer them housing and to offer them a solution. there are some studies out there now that are looking at anywhere from 50 to 70 contacts with someone before they choose to go to housing with you, which really makes sense because you'll find the same thing in advertising to purchase products and things. People don't see an ad once and then respond to it. It takes numerous times. It takes building trust and whatnot. So that's what we do. And then, people become more open to it. Usually folks that we're working with have been in, especially if they're chronically homeless and older, have been in and out of systems so many times. It's, why should I take the risk? I've been kicked out of housing. Why should I give up everything I have, the community of people I'm living with here, all of my belongings, to try this yet again when I'm not, they know they're not going to be successful. So someone's going to have to be out there continually investing time and communicating with them and offering that opportunity. And then the big thing for us that we've sort of solved is, I think, is when that outreach worker is there, they have to have somewhere that the person could go to today. Not a whole lot of sense in doing outreach if when you say I'm ready, I say, okay, let me see if I can get you on a wait list somewhere, because you're ready now. If you're ready to do this now, then I have to have something to offer you. So for us, linking our bridge housing to the outreach staff, so the outreach staff know what housing they have on a daily basis, makes a big difference.
So my answer is a little more controversial. One of the first things that I look into when I get a phone call like this is what's going on in the community, and educating the community that they need to stop supporting people living outside. That's a really hard message for people to hear, because it feels really good to feed someone who's on the street, to give them money. I'll give you an example. In my community, in one of our very affluent towns, there was someone who was homeless, and they had a Facebook page, and and they were calling this guy, what do you want for lunch? Well, and I just was like, why would he accept what I'm giving him? I mean, you guys you're catering to him and you're letting him do that. Anyway, when I was able to meet with that community and say, you do understand that I can put him in a motel tonight, and I can feed him tonight, but I need for you to stop doing what you're doing, and we need to work together and offer him this, but I can do something you can't do, which is house him. You can't do that. And in order for, you need to help me work towards that. So a lot of what this involves is educating our communities about homelessness, because people still have very antiquated ideas about homelessness, about how to address homelessness, and how to interface with people experiencing homelessness. And what it takes is very skilled, very knowledgeable people, like the people on this call, to end a very complex societal issue. And I don't think people even realize when they're making that issue worse. So yes, it's educating people. And then, do you have a place, Tom, to put them that night? You have to be able to say, nope, we're gonna do an intervention right now, but we're gonna put you in the car, we're gonna drive you to a motel. And you have to be able to have that at that moment. Or yes, it's just it's more lip service and it's another failed attempt. I agree with you. It's both those things.
Yeah, I think that's been the challenge and when we get coordinated enough that those resources are available right then at that moment in the community, then I think we'll be in a better position and more people will agree with us to stop doing the things that they're doing about feeding people in, the park or whatnot. Right now, the challenge is they look at us and say, well, can you do something? And so we have to be able to answer that question, that yes, we don't do this because we can do that. And you can become a part of that, but we can do this other thing. And I think that's hard. It's hard to enforce. I mean, parks are not supposed to be places people live. But if the only option police have is to push them from one park to the next, what's the purpose? And after a while, we start letting people live in our parks, because what's the options? And so if we have real options, I think, and right now we have them, they're just not coordinated. I think if we can coordinate that so that when the police say they have someone who's homeless, that someone would actually come out and say, I can put them in a hotel tonight, that would be new, that would be different. And I think people would be more, yeah. And like
what
Terry
are
mentioned earlier, those resources exist. We just haven't put them into play in that way. So they're there at 10 p.m.
Mhm. And one of the things we talked about before we started was take, for example, Brandy's couple that just moved in. They don't have stuff. They were on the street. So if we could harness the community to say, do you want to help us? Help us end homelessness. You want to know how? This is one way. How about we talk to that couple and say, what do you need in your apartment? Do they need towels? Do they need sheets? And people, in other words, people could be rallying around getting people out of homelessness, lifting them out of homelessness, as opposed to donating to managing, as the mayor said, managing. That's an example of how we make that shift and how your community can make that shift with you by reinforcing, because what happens then too, Brandy, is that becomes home. It's not just a place to be. It has your favorite color towels and sheets that you like and things that are specific to you, and a coffee pot or a teapot or whatever your preference is. So it's also, creating synergy around the concept of truly ending homelessness. So in other words, we're not saying stop feeding people. We're just saying, let's do it this, let's do this instead. Like, support our efforts by doing it that way. That transition takes a while, but it's happened in my community. It took years for that shift to happen, but it can happen if you're persistent. And also, how good would it feel to be able to give that lovely couple things in their apartment? I mean, how awesome would that be? And how good would that be, mutually for both?
That's a great transition, Julia. 'Cause I was just going to mention before we wrap up that OPCS is a tax credit nonprofit. So we have our home fund, which is doing exactly what Julia is suggesting, is that as an individual, you can give us $400, or a couple can give us $800. You'll get 100% state tax credit on your tax return. And we use that money for exactly those kinds of things, so that when we move someone into permanent housing, then we can help them get furniture or dishes or towels, all those things that make a house really a home. And those are the things that it's hard for us to get funding for. So we really rely on the community to help us do that. So, yeah, you can visit our website if anyone on the call is able to help us with that. So we're a little over. Maybe I'll just, Julie, just give you kind of the closing remarks here, and we'll wrap up.
So I love the end of that. And so my message would be, stop supporting the people on the street, support the agencies that will get them off the street. And that's really, and OPCS is clearly an established entity that's committed and competent to actually do this. I think it's such a privilege for me to be with all of you. And I just also want to say thank you, because during this journey of developing this presentation for all of you, I listened to a lot of what you're doing. And I actually have taken some things that you're doing, and I'm doing them in my community. Actually, tomorrow, my nurse and my social worker are going out to the motels, and we're going to be doing some things that I was inspired by Brandy and Tom and what you're currently doing. So that's really the message, is that we don't have to reinvent the wheel. There are agencies and there are services around the nation that are doing this work that we can learn from each other. We don't have to be on our own. We can reach out and learn and share, because this is very, very difficult work. But I really feel in my heart that this community, that Tucson and Pima County are going to be zero heroes. I can see it. I see it very clearly. You're on the right path. Just continue to do the work. And I hope that these webinars inspire people to really join you and support you on this mission to end homelessness. And thank you for letting me be part of it.
No, well, thank you for participating. It's been great just getting to know you and getting another perspective on how all this works, and particularly on what we're doing. Because again, I think it helps a lot to get some outside perspective to help us all understand.
Thank you.
What we're doing. So thank you very much. And Tom and Terry and Brandy, thanks. I know that Brandy and Tom, we've been through 4 of these together now, so I think we're starting to turn into old hat at some point. But no, this was a great discussion. So with that, I think we'll go ahead and wrap up. So everyone have a great afternoon. And yeah, if there are any further questions that people have, or if people want to get involved, reach out to us. We're more than happy to continue the conversation.
Definitely. You can reach us at OPCS through our website. So our emails are right there on the website. So if you want to email Brandy, you want to email myself directly, you can do that. Sometimes that causes us a bit of junk mail, but I just want to make sure that people can access us directly. And I don't know how to handle 2 phones, so I only have a cell phone. So it's all listed right there.
Great. All right. Have a good afternoon.